Sleep problems are super common for kids with ADHD. We're actually coming to understand that it may be part of the disorder itself. About 75% of kids with ADHD have some kind of problems with sleep, and about a quarter have a diagnosable sleep disorder. So, what can you do about it as a parent? Well, first of all, if you think your child may have a sleep disorder, and that is to say, if your child snores, if your child is wide awake in the middle of the night as though it's noon, if your child is tossing and turning constantly all night, or if your child is sleeping less than 8 hours per night, the recommendation would be to talk to your pediatrician right away about whether there's some sort of treatment on the medical side of things that might help, or at least further evaluation. However, if the main problems are things like your child is not winding down at bedtime, they're refusing to go to bed, they're getting out of their bed, they're waking up in the night and coming to get you or wanting to talk to you, or they're waking up too early, there are some things that can help. So first of all, researchers find that it's helpful to have a wind down window before bed, not just suddenly shutting off the lights at bedtime, but spending up to about 2 hours during which you're lowering the amount of light in the room, you're making sure there's nothing noisy going on, you're helping your child pick activities that are more restful, and especially you're not having them watch screens within at least an hour of bedtime. Those blue lights from the screen really do have an effect to keep kids awake. Second of all, you may want to come up with a very consistent bedtime routine along with your child. So talking about all the steps that need to be done before bed, and also talking about the types of rituals and connection that your child wants to be able to settle down and cue themselves to fall asleep. So reading books, having some snuggle time, checking on them every few minutes once they're lying in bed, maybe having them listen to a story or a podcast to help their brain wind down and their body get more tired. The research on sleep interventions, though, shows that one strategy tends to be the best of all. So even when you compare all types of sleep training programs for kids, the main thing that is effective is actually moving their bedtime earlier. So that may seem like that's impossible, and it's not realistic for all families. But if you can, maybe think about a 30-minute shift, and as an experiment, see if that might help your child get more drowsy. Finally, you may need to set up some behavior plan around staying in bed if that's a concern in your household. So having a bedtime pass where the child can get up one time for any reason, and you walk them back, but then if they want to get a reward in the morning, then they can't get up again. And also importantly, when your child is out of bed, you want to keep it super boring. So it's almost like your robot parent, just walking them back to their room, but not having conversation, not sighing and showing how frustrated you are, but just walking them back without any debate so that they realize it's not going to be fun and entertaining to stay up late. Again, if you think that sleep problems are kind of more than behavioral for your child, definitely check in with your doctor because it is common that things like sleep apnea or anemia or other medical concerns can affect sleep and can also affect ADHD symptoms. So there may be some other ways to help.